Hello, I'm Natasha, the current Miss Norfolk, and this is my entry for Miss England's talent round. When thinking about what I could do for this round, it became apparent that people of my generation do not know how to do CPR. This is a really important skill that everyone should know. Therefore, I have created a teaching video. The most important talent you need in life is to know how to save one. If you are unfortunate enough to come across a patient that has collapsed, you must do a primary survey. The first stage of a primary survey is to look for any danger which could put yourself at risk. This could be trip hazards or slip hazards. Next, you have to check if the casualty is responsive. You can do this by kneeling down next to the patient, tapping them on their shoulders and calling into each ear. If the casualty is unresponsive and not alert to voice or pain, you must shout for help and call for an AED. If the casualty is not responsive to voice or pain, you must check their airway. So you need to look in the patient's mouth just to make sure if there's any obstruction. Place a hand on the forehead and lightly tilt the chin. Take your ear to the patient's nose and mouth and look down the body. If you can see any signs of respiratory effort, you need to place the casualty into the recovery position. However, if they are not breathing and you do not see any signs of life, you must start CPR. To start chest compressions, you need to kneel beside the casualty. Place one hand onto the patient's chest in the centre and take the other hand and place it on top, interlocking the fingers. Lean over the patient with straight arms and push hard onto the patient's chest, 5 to 6 centimetres deep. Release the pressure, but do not remove your hands from the casualty's chest. You have to deliver 2 rescue breaths. Firstly, ensure the airway is open. You can do this by supporting the chin with one hand and slowly tilting the head back. With your other hand, pinch the casualty's nose. If you have access to a pocket mask, make sure you use it. Take a deep breath and blow into the patient's mouth, looking down the body to see if the chest rises. Do this twice. Once you have attempted 2 rescue breaths, you must start compressions again. You must keep going, doing this routine until help arrives or you physically can do no more.